I am Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. This is the second video on life-threatening infection in children. In this video, we will talk about meningitis and septicemia or bacteremia or blood poisoning due to different bacteria in children. So let's have a look first of all on this BBC News. Treatment might have saved baby. A 17-month-old child who died from meningitis should have been prescribed antibiotics earlier. So probably this is the case of misdiagnosis and delay of administration of antibiotics. That's why the outcome was fatal. Meningococcal meningitis or meningitis. Meningitis is one of the important infection in young children. Meningococcus is a gram-negative diplococci, which we can see in this slide. It is also called as Neisseria meningitidis. It causes the infection of the meninges. Meninges is a layer which covers the brain. There are 13 different serotypes of meningococcus. A, B, C, Y, W135. These are the important serotypes which are commonly associated with meningitis or septicemia due to meningococcus. So spread is always from person to person. 5 to 10% people harbor this organism in their throat without showing any sign and symptoms of any infection. So incubation period is between 2 to 10 days. In meningococcal meningitis, there is a sudden onset of this infection. So children present with neck stiffness, high-grade fever, projectile vomiting, intolerance to the light, which is also called as photophobia. So child is confused, there is a headache, and also red spots on the body. So we can see here meningococcal rash. This rash is due to meningococcus because these are the red spots. So it is also called as a non-blanching rash, which can be very nasty. So we can see in these pictures. So 10 to 15% children suffer with, because the complications are really very severe. So suffer with hearing loss, brain damage, learning disabilities, loss of limbs. So diagnosis of meningococcal meningitis is based on the sign and symptoms of the infection. So history is always suggestive of the infection. So in addition to that, different types of samples are done. For example, blood samples to check the rise of the inflammatory markers, white blood cell count, neutrophil count, procalcitonin or C-reactive protein. So microbiology samples, for example, blood culture, throat swab for culture and sensitivity, cerebrospinal fluid. This fluid is taken from the spine by syringe. So this sample is also done to also sent to the microbiology sample for examination under the microscope, as well as to process, to identify the causative agent, and to do the antibiotic sensitivity testing to check which antibiotic is more effective or will kill this organism. PCR is also done on blood and cerebrospinal fluid. So management is very important. So do not delay in administration of antibiotics, but if circumstances permit to do the samples before starting the antibiotics, then it is a good. But if circumstances do not permit to delay, or patient is in shock or in acute sepsis, then start antibiotics and do the samples after starting antibiotics. So penicillin is very good, is effective, ceftriaxone, but if these two drugs are not suitable for any patient due to allergy or any reason, then chloramphenicol is an alternate choice. Prevention is very important. Vaccination. People who are exposed to meningococcus, so they need antibiotic prophylaxis to prevent the disease in healthy individuals. Streptococcus pneumoniae eye is another cause of meningitis in children. This is the second most common causative agent of meningitis. There are 90 serotypes. A lot of people, up to the 60%, they carry this organism without showing sign and symptoms of infection. There are more than 90 serotypes of Streptococcus pneumoniae. This infection is common in less than 1 year old. Diagnosis is same as meningococcal meningitis. This is a gram-positive cocci, which we can see in this slide. Treatment is ceftriaxone or cefotaxime or penicillin. So prevention, so we prevent this disease by administration of PCV13, that is one vaccine in less than 2 years old. To more than 2 years old, PPV23. So 23 serotypes are included in this polysaccharide vaccine, while 13 serotypes are included in conjugate vaccine. Hemophilus influenzae meningitis incidence is low nowadays because of the administration of a vaccine. So 3 to 7% people are carrier Hemophilus influenzae gram-negative coccobacilli, which we can see in this slide. Diagnosis is same. Ceftriaxone is the drug of choice. 20% Hemophilus influenzae are beta-lactamase producer, so they may, this enzyme make ampicillin ineffective. Vaccine is the best to prevent this infection. So poisoning of the blood due to any organism or bacterial septicemia is another life-threatening infection in children. So source is very important. So if organisms are originating from the gastrointestinal tract due to the leak or anything or any breach, so these are the common causative agents. For example, E. coli, Klebsiella, Salmonella. If organisms are originating from urinary tract, then there would be signs and symptoms of the urosepsis. Respiratory tract, for example, pneumococcus, Hemophilus influenza, and there would be pneumonia. Streptococcus group A, B, C, or G, Staphylococcus aureus, they originate from the skin and cause bacteremia or septicemia. Sometimes patients present with septic shock due to the toxin released by gram-negative organisms or these bacteria. So patient presents with fever or very low temperature, rigors or shivering, increased respiratory rate or shortness of breath, increased heart rate, patients are confused, low blood pressure, reduced volume of urine, jaundice, and sometimes white blood cell count is either reduced or increased. Neisseria meningitidis is an important cause of septicemia or bacteremia. It also poisons the blood, but without causing meningitis. There are most cases in young children and teenagers. Death rate in less than 2 years is very higher, 10 times higher. So we see highest incidence of meningococcemia between February to March and lowest in September. So it releases toxins.